Hi, everyone, and thank you for being here, joining us for our tabletop conversation, Caring for Our Community. We'll be focusing today on mental health and its impact through the ongoing pandemic, as well as needs that were here long before March 2020. I'm Elizabeth Houch. I'm the Strategic Initiatives Associate at Central Carolina Community Foundation, and I'm going to be guiding us through this conversation. I'm fortunate enough to be joined by three other people in our community who are really experts and working more closely with youth among other populations and going to be talking about mental health today. Hi, y'all. Thanks for being here. I am going to start us off with our first question. I'm really grateful to be having this conversation, seeing as we know that mental health is something that has definitely been impacted by the ongoing COVID-19 pandemic, as well as the resulting economic recession that has really affected people's mental health in our community and created new barriers for people who are already dealing with mental health needs. And, I think a lot of people in our community would agree that there's a need for reducing stigma around mental health needs, and that we know that more and more people are seeking support during this time. So I just want to, ask you all who you are and what brings you to today's conversation. So Jessica, we'll start with you. It seems like Jessica might be frozen. So we're going to start with you, Otasha.
Good afternoon. I am Otasha Morgan. I am the lead school counselor in Richland School District 2. And what brings me to this conversation is just my work with students, my work with faculty and staff, and how what we like to call in Richland 2 the dual pandemics, dealing with COVID, impacts of COVID, as well as the racial, social justice that seem to have collided around the same time, how those impact our learning and our work with students.
Definitely. Thanks for being here. And Mac, I'll pass it over to you.
My name is Mac Caldwell. I'm the Youth Services Director for the Mental Illness Recovery Center Incorporated, Mercy, located in downtown Columbia. We, in addition to serving youth experiencing or at risk of homelessness in Richland and Lexington counties, we also serve adults who may be at risk of or experiencing homelessness and or mental illness. I'm a licensed professional counselor and licensed addictions counselor in the state of South Carolina as well. And I'm thrilled to be here today during Mental Illness Awareness Week because I do believe that mental health is an indicator for health in our communities in general.
Yeah, thanks for being here. And Jessica, on to you.
All right. Hi. So my name is Jessica Jarman, and I am a licensed mental health counselor here in Columbia, right off of Divine Street. I'm in private practice, and I work pretty exclusively with the LGBTQIA+ community.
Yeah, thanks for being here. And Mac and Otasha, I'd actually like to know where y'all are joining us from. That way we can get a sense of where we're at in this virtual space.
I'm in the Midlands area, Columbia.
Columbia as well.
Great. I'm right at the edge of Forest Acres, also in Columbia. But for anyone who may be tuning in, feel free to share where you're joining from and any questions that you might have for our panelists today. And we'll dive right in. So, what experiences in your life, your work, or your family and close relationships have impacted your understanding of mental health? Whoever wants to take that on first.
I will first. So I think for me, growing up in a pretty conservative household, as a queer brown woman, has really shaped my experience with seeking mental health, especially kind of in the areas in which I was seeking help. And I think that really informed not just kind of the emotional issues that people deal with within themselves, but then kind of how that compounds when you're trying to find a safe space to just get help.
Yeah, thanks for sharing that.
I can go next. I actually came face to face with homelessness when I was 7 years old in a hardware store in Winsboro. There was a local man there experiencing homelessness who walked up to my dad and me in the store. I was spinning a stopwatch around my finger, and he wanted to know if he could show me how he could do it. And I think right then and there, I recognized a longing for connection, and that had a profound impact on me. In college, I volunteered at a shelter in Boston that served men and women experiencing homelessness and substance use disorders. And through that work, I really began to see how important relationships were on an individual's recovery. I actually moved to Boston after college and volunteered a year of service at the shelter. I actually lived in the residential community there, and my chief duty was to develop and model healthy relationships with the residents in the shelter. After that service was over, I was hired on as a case manager, and I just firsthand witnessed the devastating impacts that mental illness, substance use, and homelessness could have on an individual's self-esteem, their interpersonal relationships, and really overall the negative impacts on hope. And I feel like the work of helping an individual recover is really critical to helping build and sustain healthy communities. And that's why I think it's so important to focus on an individual's mental health because it does impact those areas of self-esteem. It impacts their relationships, and it can reinstill hope into someone's life.
Okay, I'll go next. I am old enough to come from an era where mental health, mental wellness did not have a name, at least in my community. You were just expected to suck it up, get over it. Boys weren't expected to be emotional, those types of things. And I grew up watching things, seeing behaviors that were very peculiar in my own family and in my own community. And, they had odd names for them. They're touched in the head, or they're special, or, they were stereotyped with these labels. So I understand, knowing more now than I did then, I understand the hesitancy of being open to mental health treatment or options that are available in the community. I understand the hesitancy that some communities have regarding that whole space. And I also am keenly aware of how important language is in this conversation to various communities. And so that's kind of what informs my work and what brought me to this field.
I really appreciate y'all being so personal in that response. It's very obvious that your professional backgrounds, have this whole other set of knowledge. But I think when we have these really personal takes on how this impacts our lives and not just our professional world, makes it very real. And also, I think actually really works to make it it's something that we do interact with every day. I think that there's something that each of you shared that it's like there's an everydayness about it, and even in my own experience as well, because Jessica and I have actually gotten to work with queer and trans populations here in the Midlands together with Harriet Hancock Center Foundation, and then with Otasha, I graduated from Richland 2 schools, so this feels very close. As I imagine that it does for a lot of our people who are listening to this conversation, even if they're not with us today. But what do you see as the impact of mental health needs in your community? So this can be your professional community or even your whatever you call community. And I'm curious to know if you've seen changes in these issues over time, especially in the past couple of years.
I do know in my work in the district, and I work with school counselors. I don't, work directly with students always, but sometimes I do. Um, we have just seen an increase, and this is before COVID, an increase in issues with anxiety, coping skills at younger and younger ages. So we're talking about first graders sometimes struggling with issues of anxiety. And this is outside of the what would be a normally developmental issue. So, in my community of students and staff, and I consider staff as a part of my work as well, um, we've just seen just a lot of stressors that, sometimes kids as well as sometimes teachers are get very close to a breaking point. And so we have to really keep eyes, ears close to the ground, so that we can, be first responders, and helping them through that. But we've seen definitely an increase in the need for mental wellness strategies, mental wellness resources, just within the school community. So that's a reflection of what's going on in homes as well.
Yeah, to kind of echo off of what Tasha was saying, pre-pandemic, one of the things that I was really seeing an increase in, even amongst my older clients, is anxiety and depression, hopelessness. And I think when we look at the events of the past, maybe few years, for marginalized communities, which essentially are the community as I serve, it's been difficult. The problems have always been there, but it's been especially painful, I think, and frightening to see them clarified and to see the response to that clarity. And so I think that informed a lot of that. But I know within COVID, one of the things that I've seen is actually any gains that maybe my clients had therapeutically prior to the pandemic, just huge backslides, because, well, for so many reasons. I mean, it's a really stressful situation. A lot of people of color within the trans community have experienced so much loss. So there's this huge infiltration of grief, and an inability to grieve together in a meaningful, supportive way. Feedback loops are gone, right? So when I'm trying to learn a new skill for emotional regulation, a lot of the feedback or the prompting events that I'm getting to help me practice and figure out if I'm doing a good job come from external sources. And we just don't have those right now. So, and then, one of the things to top it all off, that I've personally experienced and many of my colleagues have as well, is the need is so high right now, but as therapists, we're in it too. So the burnout is high and the need is high. And so it's just been really hard to get everybody the help that they need because the availability is so limited right now.
I do think that one thing that became apparent to us in our work with youth experiencing homelessness is the pandemic revealed alarming rates of mental health problems. I think that was not specific to our local community. I think that was occurring and is occurring across the country. But a survey that was released in June by Chapin Hall at the University of Chicago saw much higher rates of anxiety and depression in 18 to 25-year-olds compared to older age groups. And that was definitely our experience at Mercy, as the rates of youth reporting mental health problems at intake more than doubled following the onset of the pandemic. I'm not sure that we've yet realized the long-term effects of mental health issues in our local communities. I do think we can continue to expect diminished function, increased mortality, lower social economic status, increased physical health issues. But one thing that's very poignant to me, and particularly as we have this conversation today, is the need that we all have for personal connections. One of the things we noticed in conjunction with the rise in mental health problems was also the some of the highest outcomes that Mercy has observed in the past several years. And some of that was directly linked to our determination to maintain face-to-face therapeutic interventions and face-to-face contact with our consumers. So making sure that we figured out ways to safely therapeutically intervene to help someone maintain their housing in the community, to help them effectively manage their symptoms in the throes of the pandemic that was isolating so many people, and helping them obtain or maintain income. Just some of the best outcomes, frankly, we've recorded in the past several years because of that determination to make sure we remain connected and helped our consumers stay connected to each other and to supportive staff in ways that were safe. I think that was something that stuck out to us as well and continues to stick out to us as we see the surge occurring with the Delta variant now.
Yeah, I appreciate you sharing that. You know, listening to this, I'm thinking of different conversations the Community Foundation has held around some of these compounding issues and needs, as all three of you have really touched on, whether that's people who are experiencing houselessness, queer and trans populations, students of, youth in and of itself, Black and Brown communities. And I would encourage anyone who's tuning into this to check out those previously recorded conversations over at onthetablecola.org. And I'll say that a little slower, onthetablecola.org, because we really focused on the need for affordable housing, social justice as a need, and different points of intersection there, as well as food insecurity. So we know when it comes to mental health, all of these issues are so inextricably interconnected. And, hearing you, I am a little curious of how you all take care of yourselves. I know Jessica mentioned, y'all are all going through it too. It's not somehow separate. And so I'm really curious to know, and, it might even be supportive for other folks to hear how you care for yourselves in this time.
Well, I actually live in Winsboro now. My wife and I own a Christmas tree farm there. And so there are lots of farm chores that keep us busy throughout the year. But I really enjoy gardening. So I spend a good bit of time in my vegetable garden through the spring and summer. I actually coached Little League Baseball and T-ball for my kids this year. And that was something that just sort of took the focus off of some of the negative things going on around us and really put the focus on that. I think diet and exercise as well have helped. I think of self-care sort of like a car. My car runs optimally when the gas tank is full, and when it's empty, it's hard for it to run the way it's supposed to run. And just like my role as a helper or as a professional counselor, when my tank is full, I'm going to serve the clients entrusted to my care optimally. And when my tank's empty, I'm not going to give them the best care I can. And so I try to keep that in mind as sort of the philosophical framework behind why it's so important to take care of ourselves.
It depends for me. Sometimes I am a better self-carer than others. I do try and be very intentional because I do teach a lot of mindfulness to our staff. So I try to make sure I'm practicing what I preach, but there are some times that it's just, I get lost in the moment or I get lost in the emotion and, I'm flying, cape flapping in the wind and, I'm just out there. So, but when I am very intentional, I try to do the things that recharge me. My husband and I, we like to travel. And so sometimes we'll take little short trips. It could just be to Greenville, or to Charleston, just to sort of change the scenery a little bit. I try to, hook into, I call myself a hobby hoarder. So I've got lots of tools and things for crocheting and all kinds of crafts. I thought I was going to be a painter. I thought I was going to be a seamstress. So I've got all of these little things that sometimes I'll just jump on, my sewing machine and just do something just to sort of recharge. But it takes intentionality. And like I said, sometimes I'm a lot better at it than others.
Some of the things that I've been doing that have been particularly helpful is I engage in a mindfulness practice. It doesn't have to be long every day. It is non-optional. And I've been very intentional with my personal boundaries as far as like work, because the demand is so high. And as helpers, we want to overextend. So I actually have another therapist who's my accountability buddy, and I'm her accountability buddy. And we essentially check in whenever we're like, I think I'm going to take on this new client. And we're both kind of like, do you have the space for that? And I think the best thing I've done is I have created a day that is sacred. It is my day. I will not do anything. I will not make any plans with anyone that day. And it's always the same day of the week, which is really helpful, because I find that if I move it around, I'm always going to put something there. And that day is just a day where I spend accumulating positive experiences, kind of getting to that gas tank analogy. So, but one of the things that can be helpful as well, that is accessible for free, or if you wanted to buy it, there is a deck of cards on, I think you can get it on Amazon. It's called the DBT deck. And it's just a deck of cards that lists a skill. And every day you can pick up a card and look at a skill. But if you can't afford it, you can just Google DBT skills, and same thing every day, just pick a skill, practice it, kind of keep yourself as grounded as you can.
Yeah, I really appreciate those. There's such an emphasis on the reconnection with the body. And I think, as we're seeing as yesterday, when we saw different social media platforms go down and connection tools go down, even if that connection, whether or not it's real or not, though, I mean, some of them are really excellent resources. Like, I know that even in my social media use, there's a lot of really great therapists that I follow, provide a lot of really excellent grounding tools. So even being disconnected from that was different. But, some people have been sort of making jokes about, like, it was a forced time to be off of our phones and be away from our technology. And, and that's something that even around when we create our mental hygiene. So, that can, of course, look like a mindfulness or meditation practice, but even our mental hygiene as far as scheduling that time on the calendar as though it was a non-negotiable appointment for yourself to spend time just with you, or doing things that you love and enjoy to reconnect back. Because it's often, I actually was doing some searching yesterday to see what are some different things that we could share with people today as far as resources. And among them included, making sure you're getting sleep, which can obviously be impacted by mental health. But among those was also, getting off of your technology, which is a really big part of the conversation, especially as Otasha referenced to these multiple pandemics that are going on. It can absolutely be overwhelming to the nervous system. And it's, of course, incredibly privileged to be able to say, like, I'm able to take this physical space or schedule out this time in those kinds of ways. So I want to acknowledge that. That's where even tools like I found breathing to be very helpful, and just closing my eyes and taking 3 breaths. And that sometimes feels a little bit more accessible, because sitting down for a true meditation process can feel overwhelming in and of itself, right? Because then you realize, like, ooh, I haven't been doing so good at this, or I'm in a spot where I'm not feeling great. And also having to acknowledge and not just be in denial that you're not doing so great in comparison can be really big too. I want to close this out with knowing what resources are available to folks in the Midlands, particularly Richland and Lexington County, as you may know of any, that exist around mental health care. And I'd also be sort of curious to know what resources you think are needed in our region as well.
I saw that, Mac. I'm going to speak from the perspective of students, parents. If you're in Richland too, we are very fortunate in our district, and very resource. I don't want to use the term rich for overstating it, but we do have access to a lot of resources for our students and for our families. We serve 28,000 students, so that's a lot of kids that are out there. One of the things that is really unique in our district is that we provide licensed professional counseling through our family intervention services. Now, it's a small division, but it's something that we can do in-house of no charge to our families. And we have therapists that are on our staff that provide counseling for students as well as their families. They don't prescribe and diagnose, but they provide that second or third tier level of assistance. For those who are not necessarily in Richland too, I would advise you to start with your school counselor as a parent. If you're seeing signs where your child is experiencing difficulty or experiencing stressors in an abnormal way, reach out to your school counselor, and they can sort of help you navigate what's available. A lot of the community resources, we could rattle them off, but they can just sort of help clear out some of the clutter for you and get you directly to where you or your child needs to be. And there are lots of wonderful resources. As many licensed therapists that we have, we still don't have enough for the needs that are out there. But in the Midlands area, which I know is a different story from where you are, Mac, in a more rural area, the access to resources, there are not quite as many barriers. Not saying that it's wide open, but there are not quite as many barriers as maybe a more rural community may experience. But if you're in the Midlands area, or if you're in any area in South Carolina and you don't know where to go, start with your school counselor and they can help you navigate that.
That's useful. I hope I never thought of that as like a touch point. And so that's a really great resource to share. Thank you for that, Natasha. Jessica, any from you?
Yeah, so actually a similar recommendation. If you don't have kids who are in school, the School of Counseling over at USC offers low cost to free counseling services. So if that's a need that you have, that's a great resource. I also want to give a huge shout out to Mercy and to STSM for their work and for being safe for the community. And then, yeah, I think the thing I would say, especially for the population that I work with in my community, is when you're looking for help, it can seem like there is not a lot, but don't be discouraged. You just have to pick up the right stone and turn it over. We are here. It's just not as on its face as I hope it will be one day. And then, yeah, I think I was thinking a lot about what we need specifically with my community, and our resources are pretty limited here. But I honestly think, thinking about the things that affect our mental health, the things that we need are strong allies. We have a lot of people that say that they're allies, and what does that mean? If that means that when somebody tells you something about QIA plus population negatively, and you get upset about it, I mean, that's great, but we need action, and we need informed allies who can take action. I think that's something we're really lacking, because if our allies are not informed, it's going to be difficult for us to get the need or the care that we need. I think one of the things that always surprises people to know is that in our state of South Carolina, you can be a licensed mental health counselor through the state and provide conversion therapy services. No issue with your license there. So yeah, I think that's what we need.
I would echo a lot of those same resources. I do think the USC Psychological Services Center has tremendous resources available. I think those individuals in private practice like Jessica, who are willing to meet with people face to face or via telehealth, whatever makes them feel most comfortable during this season. I think there are a number of really excellent private providers in our community who are willing to accommodate whatever makes consumers feel the safest right now. We work closely with the family intervention services at Richland too. I'd shout out to them. I also think, the LRADAC for issues where mental illness and substance use disorders might come into play. LRADAC's a really great resource in Richland and Lexington counties. I do think Mercy's a really good resource. We have added some capacity in the last 6 months to accommodate the growing number of individuals reporting mental health problems, both on our youth outreach team and on our adult outreach team, so that we can do mental health screenings more quickly in the community and help folks get connected to available and appropriate resources as quickly as we can. One of the things I think we seriously need to explore that impacts individuals with long-term and chronic mental illness is the need for more long-term inpatient psychiatric hospital beds. We do not really have many, if any, long-term inpatient psychiatric beds to speak of. And that is a growing need in our community, particularly as people are being displaced from their homes, as eviction moratoriums lift and as the pandemic rages on. That's one need. Affordable housing is a second need, I think, that comes up from time to time, but we cannot ignore the links between physical health and mental health and emotional health, affordable housing, affordable health care. I think those things go hand in hand, and I think those are some things in our community we could explore further, and we could benefit from having more long-term inpatient psych beds and more affordable housing units.
Yeah, I think it's that hierarchy of needs. It's like we have to assess these physical needs, and that's what I found kind of interesting about the self-care practices you all employed. They were really on that more physical level, and that way, we can make it this really mind, body, spirit connection, right? But also realizing that there are resources in our community, though there are others that are needed as well. I think it's always useful to be reminded that they're there, because oftentimes I think that access is obviously a huge barrier, and knowing what's here, even just as a starting point, can often be useful in getting the support that you need, and is another way of community care, right? Like, I think what Jessica shared as far as being an ally, and while that's more specific to queer and trans populations, it's also looking at how we can actually be in support of each other. And if there's someone who who is experiencing a difficult time, of course, feeling with consent, being able to say, hey, have you considered this resource, or did you know about this? And even if that's as they make that phone call, you being present with them, or whatever that might look like, or even just getting that email chain going with someone, that sort of thing. I mean, it's not that we say community care and supporting each other, like you yourself need to offer all that support, because there are professionals for that. But it is an opportunity to just say, okay, what can I do? And knowing that this is our whole community who's being impacted by these needs and will likely continue being impacted, right? I mean, I think that's the reality of it, is that it's not a stop finish finite point, because that's not how humanity works. that's not how we're set up to be finite. We're always growing and changing, and so our needs change. And I think being very real with how our needs might have changed even in the past few weeks, even from yesterday, right? So I just really appreciate you all sharing both your personal and professional perspectives today. We'll be sure to share out some of those resources through onthetablecola.org when we post a recording, and that way folks can figure out how to get where they might need to go. Are there any final words that anyone wants to share before we hop off today? It's okay if not.
I'd just like to thank the Community Foundation for hosting conversations like this and bringing issues like this to light in our community. I think it's so important to be hosting these types of conversations. So thank you all so much for having us.
Of course, we're excited to be able to.
And thank you. Sorry. Thank you, everybody, for all the work that you do to help our community.
Mm-hmm. Great. Well, thank you all so much. We hope that you take care of yourselves in whatever way that you see fit. And hopefully this brings some kind of awareness. And if you're interested in having a conversation similar to this one in your own community, On the Table will be March 6th through 12th. There will also be a conversation guide available on our website, onthetablecola.org, after this. If you decide that mental health is a conversation that you want to continue talking about with your friends, colleagues, neighbors, loved ones, and dive a little bit deeper. So thank you all so much for the work that you're doing to support our community. And thank you all for joining us. Take care.